Good morning. This is Dr. Ramani, Professor of Pathology and Academic Dean of Mallaredi Medical College. Today we'll be having a talk on doctor, a lifelong learner. So, what is a doctor and why should he be a lifelong learner? So, let us go into it. Let's look at the some of the pictures here. So you can see here an elderly couple enjoying with the game of chess, and there is a caretaker beside them. And here you see that there is a run marathon being run, and a lady, obviously above 60 years, having a race. And this is grandfathers and grandmothers attending their grandchildren's school. And here you look at a very old lady having uh, and she's trying to learn the computer skills. So, what are the objectives of my talk today? We have to define the lifelong learning. We have to list the benefits of lifelong learning, identify the learning methods used in lifelong learning, specify the techniques to be a lifelong learner. Unless we keep learning, the day we stop learning, it is the day we are dead. This is what I believe. So, William Osler says that the hardest conviction to get into the mind of a beginner is that the education upon which he is engaged is not a college course, it's not a medical course, but it is a life course for which the work of a few years under teachers is but a preparation. So, now let us just review the history of lifelong learning. Use of this term is traced back to 1920s and is used by B.A. Exley and Lindemann, but it was popularized by the work of UNESCO in 1972. Delors' report says Learning the Treasure Within of UNESCO declared lifelong learning framework approach with four pillars enabling the individual development. So it is important to learn to do, learn to be, learn to know, learn to live together. I will repeat it here. Learn to do, learn to be, learn to know, and learn to live together. So these are pillars: learning to know, learning to do, learning to live together, and learning to be, which is very, very important. Learning to be is the most important. So now let's go back to the definition. It is defined as a learning that is carried on for the entire life, is flexible, varied, and accessible at all the times and in different places. It is recognized as a continuous, constant, unending lifetime quest which starts with birth and concludes only at death. Death. This is what I was telling. The minute we stop learning, we are dead. So this is how you see progression of a small child going to school, a college, and a worker, and a manager most probably, and an older manager, and finally an older senior citizen also learning. Even at this stage, he has not stopped learning. So GMER, why are we bothered about all this? The GMER, the NMC has said that the student, undergraduate student, has to be a lifelong learner because he has to demonstrate the ability to perform an objective self assessment of knowledge and skills. Continue learning. This is most important. We have to continue learning. We can't stop learning. Refine the existing skills and acquire new skills. We have to demonstrate ability to apply this knowledge or skills to care of the patient. Finally, we are here to take care of the patients. We have to demonstrate ability to introspect and utilize experiences to enhance personal and professional growth and learning. Demonstrate the ability to search, critically reevaluate medical literature, apply information in case of the patient, care of the patient. We have to be able to identify and select an appropriate career pathway. The students, apart from their studies, they also should know where they're going to land up in, which career they're going to land up in. So, why is lifelong learning important? Do we need it for employment? Do we need it for knowledge? Do we need it for social status? Do we need it for community service? Yes. So we have to have a thinking. What shall it be? So now it is now being produced at an increasingly rapid rate. Technologies have become more complex, and we have to learn something new every day. We have to upgrade and reinvent skills, and learning needs to be implemented from childhood to adulthood. So to the principles. So everything has principles. Here, the principles of lifelong learning are Self motivation. Unless there is motivation from within, it has to be the driving force. Somebody comes and says you have to do lifelong learning. It won't happen. It just drops. Flexibility. We have to adapt to different learning environments and methods. Continuous improvement. Always there should be room for growth and improvement. Collaborative learning. We have to connect with others to share ideas, experiences, and knowledge. Foster a sense of community and collaboration. We can't sit in a room and try to learn. So it doesn't happen that way. Resilience. We will have a lot of setbacks and challenges. We have to be strong in spite of these setbacks and challenges. So there are many types, characteristics: formal, informal, professional, personal, indirect, self-direct. Formal is where a college education. Informal is somebody is driven by personal interest, attend conferences. Professional, networking and workshops. Personal, where you have some hobbies, unusual activities like writing books or whatever. Indirect is where you're traveling. When you're traveling or volunteering, indirectly you're observing and acquiring skills. Self-directed, where you want to learn a new language, which is very important. So, what are the important skills helpful in competence of lifelong learning? Metacognition. This is a new term for all of us. It's a higher order thinking, having active control over cognitive process involved in learning. It involves awareness and self-regulation of one's learning process, includes an awareness and understanding of how one thinks and uses strategies. It involves knowing how to learn. It is concerned with self-reflection, self-responsibility, and initiativeness, as well as goal setting and time management, which is very, very important. So here the student is metacognition. This is I'm feeling, I'm thinking, I'm seeing, I'm wondering, I'm noticing. So this is a student, that is you. So the student is noticing something. He's wondering what's happening. He's also seeing, he's thinking, and finally he's feeling. This we want the students to understand. So what is introspection? In self assessment, students appraise. This is introspection. The student is appraising standards of their own work and learning, evaluate and scale extent of achievement of learning goals, reflect on strengths of their learning and learning gaps, look for improvement opportunities accordingly. So, what is interaction? Yes, here you can see a group of people sitting here and interacting. So, specific learning interactions and collaborative learning are valuable characteristics. Interactions can be in the family. Yes, it is important that every day we interact with our family members, with peers at our work, at workplace, and social gatherings. And they provide opportunities not only for discussing expectations, they also give feedback. Something is wrong with us. So there is a feedback, a positive feedback or a negative feedback. We have to take it and try to learn and grow. Other is we all have different individual learning styles. So consideration must be given to it. Processing of information, retention, and recall are all directly related. So processing, you're getting some information. How do you retain it? How do you recall it? Because in the theory exams and the practical examinations, you're supposed to recall all this information. So students learn through various styles by personal meaning, by conceptual learning, and by knowing how things work and by self-discovery. So these are the learning styles, which is known as VARK: visual, auditory, read and write, kinesthetic. And this is a questionnaire with many available versions to identify. So visual learning, auditory learning, kinesthetic learning, reading and writing. Okay. So, what are the set? How do you set the goals? It is important that you have smart goals. So, you have to set the learning goals, and attaining them helps with self assessment and cultivation of lifelong learning behaviors. So, your goals should be specific, measurable, signable, realistic, and timely. These are the things which are very, very important. Unless somebody has a goal, we don't know where you're going to land up with. We'll just be wandering here and there. So, how do we adopt these reinforcing techniques, learning methods? Should have prior learning experiences. The medical students have already done their plus two and they're coming to the medical schools with prior learning experiences. So, they should acknowledge their understanding and experiences with appropriate instructional strategy. Finally, at the end of the medical school or a postgraduate school, you have to cultivate lifelong learning behaviors. So, online learning management systems, conduction of posters and quiz competitions, and for which, of course, you'll be given prizes. These are very important. How do you manage your time? Students must prioritize their time and utilize it in best possible way. And the time should not be running behind you. You should be aware of the time. Avoid procrastination as time loss will never come back. Look at this man now happily watching most probably TV, having his cool drinks and some chips. Obviously, he's wasting his time here. So, what are the instructional methodologies for cultivating lifelong learning skills? Keeping track of newer advances, diagnostic techniques, treatment protocols, information on updated reference ranges is a precondition for making successful and immediate diagnostic and treatment decisions. Instructional strategies that profess to foster lifelong behaviors by involving students in self directed, self assessed, problem oriented learning experiences. So, the students should understand that the lifelong learning is self-directed. It is no longer parents are forcing you, the teachers are forcing you. No way. You have to have self-directed, and you also assess your knowledge, like how much you're attending, how much you're learning, and you should be able to have problem-oriented learning experiences. When the patients come to you, when you have some certain experiences, you should be able to analyze. So lifelong learning is problem based learning, e learning, reciprocal teaching, professional portfolios, and reflection. So, what is traditional learning? We are told what we need to know, we memorize it, and problem is assigned to illustrate how to use it. Problem based is problem is assigned, we identify what we need to know, we learn and apply to solve the problem. So, problem based learning, here you can see that the teacher is giving a problem and it is run through four phases. So, phase one, analyzing. Phase two, self-directed learning. Three, application. He's thinking, now what is wrong? What is the thing? Sir has given some history. So, what is it? Phase four, application. So, how do we give an IV? How do we give an IM? All these are problem based. And four, phase four, reflections. You have to sit back and reflect on yourself. Where did I go wrong? Why did I not get the diagnosis? So, next time when you do it, you get it. So, self monitoring and reflective behavior. You should be skilled enough to monitor your own progress. Nobody is going to sit and tell you, no, do this, this is wrong, this is right, because you should learn it. This is lifelong learning. And phase one, here you can see phase one is analysis. So phase two, self-directed learning. Phase three is application. Phase four is again summarize and phase reflections and recall, identify the gaps. So where do we use it to? We had to introduce to students during initial days. So we do foundation course, ideal to sensitize, and early clinical exposure, where the students are exposed to clinical scenarios. They are in just they finish their intermediate or plus two, and they come to us. So in the first year, we show them that suppose we are talking about anatomy, we show them something related to anatomy as a clinical case. Likewise, physiology and biochemistry. This is where the early clinical exposure has come in. So, e learning. What is e learning? It's electronic learning, and where individuals or groups, online or offline. Online mode, we had experienced it suddenly when there was a lockdown on and during Corona time. So, we had online teaching through computers and other electronic devices. After the college time, you have time for videos, educative videos, not the silly videos, funny videos, and all. Yes, for time pass you can have, but for learning, you should have a web-based learning, online learning, internet-based learning, because it is flexible. These educative videos, you can see them again and again. Whereas in the class, you miss a part of the class, you can't get it back. Whereas in a video, there is an advantage of that you can see it again. So you also couple it with assessment. With e-assessment, where you can have an online test and you can assess yourself. What's wrong? Where did I go wrong? Reciprocal teaching is where collaborative learning group and questioning, summarizing, clarifying, and predicting. So teacher and group of students take turns in discussions regarding topic to be understood. Portfolios. What is a portfolio? Previous days, people used to write diaries. So now we have logbooks. Portfolio is almost a logbook. Only thing is, it's a development over logbook. It is a systematic and well designed collection, and it depicts academic achievements, development, and progress over time. Portfolios cultivate lifelong learning skills by promoting self motivated learning, collaborative thinking, and self-assessment. So it's an internship is an ideal time for medical students. You have to keep on writing. So now the day has come where NMC is advising that we maintain e-portfolios. Now they started for postgraduates from batch of 23. So it's going to slowly come on for the interns also. So what you do is you maintain a page. It's like a web page, and you write your whatever is happening in your life. So reflections is, I've already told you, you have to sit and reflect on what went wrong, what went right, and how you develop it. So now, what happened? So what? Now what? So reflection is what happened. You will be describing an event. Suppose you attended a CME or a conference. What happened? So what? Yesterday there was a CME or conference. What happened? Think and analyze, draw conclusions. And now what? After attending that CME or conference, what next you want to do? So suppose you attended a pediatric conference, maybe it will set your mind to doing pediatric pathology or pediatric post graduation. What is reflective writing? Reflective writing, you see something, so you keep writing about it during, especially we are doing it in the foundation course, mentor mentee programs, and student doctor method of clinical training, where we ask them to write what is, suppose you see a case. In short, it is like writing a case history. Okay. So these are the knowledge maps where you survey the knowledge, what is there, what is the brain starts ticking. And it can be mind maps and concept maps, and construction needs subject to knowledge, understanding subject to related concepts. So practical ways, how do you do it? So reading, dedicate time for books, articles or blog posts. It can be personal or professional. Podcasts, listen to podcasts on various subjects, online courses, networking, volunteering. So what is this impact? You cognitive health and mental agility improves, neuroplasticity improves, your brain is always flexible and adaptability. So you don't go into dementia or schizophrenia as become more. There is memory enhancement, reduced risk of cognitive decline. So conclusion, lifelong learning is a professional competency for medical students, and four attributes are metacognition, self directed learning, self monitoring, and reflective attitude, cultivated by instructional strategies as per institutional feasibility. Once these lifelong learning attributes are inculcated, medical practitioners will always be current. It is important that we don't become outdated. So, our mindset has to improve, our time management skills have to improve, and self motivation should be there. We should reflect on the progress, and the goals should be smart. So Michelangelo, at the age of 87, he said, I'm still learning. Just imagine, like if he can at 87 learn, yes, we all can also do it. Thank you. Sai, Sai,